Welcome and thanks for joining us. My guest today is Sherry Hebert. She's the Vice President and Chief Operating Officer of Compass Rose Benefits Group. Sherry, good to have you with us.
Thank you. Thank you for having me.
Now, let's be honest here. Compass Rose is not exactly a household name in this whole market. So tell us more about the company and how long you've been in the FEHBP.
Yeah, well, we have been in the business since 1948. We started out supporting members of the intelligence community, and we were close to just that community for many, many, many years. And then in the early 2000s, we decided we needed to start expanding out. And so most of that came after 9/11, when the idea of insurance across the intelligence community and beyond was becoming more important, so employees could choose and they didn't have to based on where they worked. So we expanded out to the whole Department of Defense, retirees and active employees. And then we went on to expand to Department of State. And we're most excited, we expanded last year to the entire Department of Homeland Security. And our mission is really to support those people that defend our country. And defense can come in all different shapes and sizes. So it's either intelligence, diplomatic, defense. And so Homeland Security made a nice fit to kind of finish out our eligible population. So although we're not a household name, we're getting out there and expanding to more people. And honestly, we probably will never be a household name because our goal is not to be the biggest. Our goal is to be the best for the members.
So you have experience with people that in some cases put themselves in harm's way.
Absolutely. And the way we like to operate is we don't want any of our members to have to worry about their insurance or their claims or their families that might be at home. To worry about, are they going to get the right care they need? We take that on. So if there's a problem with the claim or something, we want you to call us and let us take care of that for you. So being a small to medium-sized health plan, we can still do that. And so we are very member-centric, and that's important to us. It is our fundamental point in our whole mission statement is being there for our members.
All right, and so we are now just upon open season for the next coming year. And people tend to look mostly at premiums when this comes in and they make their choice of plan. Premiums are not the whole picture, though, in terms of total cost of ownership and benefits and so forth. So explain what the calculus should be beyond premiums.
Yeah, so obviously premiums are the easiest thing to look at. And when you think about all the other out-of-pocket costs, so your premium obviously is coming out of your paycheck. But what are the other out-of-pocket costs that you could be faced with? So you could have a low premium, but a very high copay when you go to the doctor. And that could be a shock. If you have to go to the doctor and it's going to cost you $50 to see a doctor and you happen to go, more than a couple times, that can add up fairly quickly. So you have your out-of-pocket costs for copays, deductible. How high is the deductible? You hear of high deductible plans. So you would pay that deductible before insurance would kick in. So although your premium might be low, you could have a very high deductible. So is that okay with you? So really it's looking at what your home situation and then what your kind of out-of-pocket would be. So if you're a young single person that never goes to the doctor, maybe those deductibles or those office co-insurances aren't that important. However, if you have young children and you seem to be at the doctor, I'm a grandmom and I know they're taking my grandson to the doctor all the time, well, those can add up very quickly. So as an example, at Compass Rose Health Plan, our copayment to go to see your primary care is $15, which is pretty inexpensive, and to see a specialist is $25. So that would be something I would ask people when they're coming to us and asking, are we the right plan for you? Is that important to you? And our deductibles are like $350, $700, single versus family. Is that important to you? And our out-of-pocket maximums, I don't know if that went off the top of my head, but those are all things that people should be looking at. And then of course the benefits. Is it going to cover the benefits that you need based on where you are with your situation or your family? Do you tend to travel? Do you need nationwide coverage? Does it have out-of-network coverage? Do you have overseas coverage? All those things as you think about your year that's coming, are any of those things going to be important? And then you should make your decision looking at all of those things. We're thrilled this year. Our premiums actually went down. So in an age of inflation and all these things, our single went down by, I want to say $17 a month. Can't quote me. There might be some pennies difference. And our employee plus one and employee family went down by almost $44 a month, which is like $500 a year. So we're real thrilled with that. And again, but that again isn't the only thing people should look at. Look to make sure that we have the coverage you would need, or any health plan would have the coverage you need. Certainly look at your prescription drug benefits. We don't want anybody in our plan that it's not a good fit for, because they won't be happy. And our goal is to, like I said, we're member-centric. We want you to be in the plan, to be in our plan. So you got to look at the whole picture. It's easy to look at that one thing.
And that question of overseas and out-of-network is really important for some of the clients that you seek, like, say, the Diplomatic Security Service is almost totally deployed outside of the United States for the State Department. So maybe go into a little bit about what some of those benefits are.
So what we love about our overseas coverage is we cover you as if you're in network. So if you will go overseas, you go to the doctor you choose, and we're going to cover you as if you're in network, which is 90%. What's nice about that is overseas, they don't have huge networks overseas. Not like here where you go and you show your card and everybody's happy. Are there some like that overseas? Yes. But if you're in some of these remote areas, not so much. So you could go see a doctor, you file your claim with us, and we're going to pay you 90% back. So we try to make it super easy for those people that are in those situations. And given our population, it's really important to be available to our members when they need us, to get that money back in their pocket if they've spent it. So that's our overseas coverage. Yeah. So go to any doctor you need to, and then just file a claim, and we'll get you paid right away.
And you mentioned premiums went down by, well, my calculus is that's 3 doctors' visits per month worth of copays, by which the premium drops, if you look at it in those terms. How do you keep costs down as a supplier? Yeah,
so we, as a nonprofit organization, we work with partners. We work with United Healthcare is a big partner of ours, and we work with them jointly to keep our costs down. It's important to keep our members healthy, which ultimately keep our costs down. So we have lots of programs to intervene with members when they need help in finding the best care for them. It's not always the cheapest care, but if I can get you better, quicker, with a premium designated doctor, which is what we love to get people into, we all win. And so we work on from different aspects to keep our premiums down, but we work really closely with our partners to do that.
So that vertical integration then really comes into this as a way to keep control of those things.
Absolutely, yeah. We work real hard at that, and so far so good on that. Yeah.
And the other issue that comes up in open season is this, and you mentioned this briefly, the stage of life that a person is in. Say you are that young security type of law enforcement person, and you're running around, you're out there, you drive cars backwards real fast down alleys and so forth. But then you might get promoted to management, and you're in the office or back in D.C., which means you need to reevaluate your insurance as your stage in life changes. Talk about some of those considerations.
Sure. So, as a young person, maybe new to government, maybe doesn't have a family yet, is just worrying about themselves, different, they would look at different plans. Maybe a super rich plan like Compass Rose is today, maybe it might be too much for them, to be quite honest with you, because they might only see a doctor once a year. So we would look at premium and out-of-pocket costs for them. But as they mature, or as they have a family, or they have the children, or maybe we have a health condition, or something that's going to require specialty medications, you're going to want to look at those plans that cover those life stages. Certainly our mid-career, our folks, that's kind of our niche market right now, because we have such a rich plan, and because we keep those deductibles low. And so the people that end up having to go to the doctor more than once a year for their wellness checks, we're a good plan for that. And then also as we get older and we move into Medicare and Medicare Advantage, we launched last year our Medicare Advantage program, which we're really, really super excited about, to help the people that are over 65. You don't have to be. I know some of our folks, we've gotten feedback, well, I'm not old enough to be in I'm not unhealthy enough to be in a Medicare Advantage. And it's not about health or not health. It's honestly, if you turn 65 and you have that Medicare A and B and you're within the Compass Rose Health Plan, you can join our Medicare Advantage. And all it does is give you extra benefits. It takes away nothing. Free memberships at a gym. Well, a necessarily unhealthy person might not use it, but a healthy 65-year-old would. So.
Or they could use it to get healthy if they're
not.
Or
get healthy, absolutely. I mean, that's our goal ultimately, is make sure your quality of life is where you need it, and most of the time that comes around health. So our Medicare Advantage program has lots of things to help those of us that are creeping up on that age think about what those things are, because some of it doesn't come naturally to us because we resist it, right? We want to resist that idea that we're getting older, but when you have a plan in place that can help you stay healthy, why not?
Sure.
Why not?
And I guess to the degree that large numbers of people do that, in a sense, they control everybody's costs to some
Correct.
extent.
So much so that we were able to increase our subsidy for our Medicare Advantage folks to $125 a month, and they can use that to offset their Medicare Part B premiums. So last year we were at 100, this year we're at 125. Just for those reasons, we're able to keep those costs level, and we're really excited about that. So that puts money back in those folks' pocket as well.
All right, and again, back to this particular open season for the coming year, what are some of the unusual options? You've got some things that you don't see on every plan that Compass Rose is offering.
Yeah, so one of the things that we love is our unlimited virtual visits. So if you need to see a doctor and we use Doctors on Demand, you can do that as many times as you want. There's no limit on that. We know that after COVID, a lot of people like the virtual, and you don't have to get out of your bed when you're sick. You can just call them, and they might not want to see you, but you get to see the doctor, and they can get you a prescription if they think you need an antibiotic, and you're off and on your way. So unlimited virtual visits. We also have a massage therapy benefit, which a lot of people have taken advantage of, which I would take advantage of if I had that option. And we also, last year or the year before, we ended up with starting a virtual physical therapy. So you can do your physical therapy in your home. And it's very, very popular. We know that a lot of people, and I'm one of them, your doctor prescribes physical therapy. You go once or twice and you're like, I got this. And you try to do those at home. Well, if you're doing it at home, you can still have the expertise there with you to do it with you. So people are hanging with it longer, so they're getting better faster. It's really proved to be a really popular benefit.
Because the PT, the physical therapist, they'll push you that extra inch that
They
you may
will.
not do
Yeah.
on your own.
Yeah, they take it a little bit farther, and you do when somebody's holding you accountable.
Absolutely.
So.
And by the way, on the massage therapy, does that also have to be prescribed by a physician?
Nope. And we get up to $60 for a visit, and I want to say it's 12 times a year, so you can go once a month and have a nice massage. So no, and that's just on your own. That goes to that wellness piece.
And for those that may have chronic pain, what about the pain management field?
Yeah, so we actually have a team that works with folks that are in those conditions. We started it last year, and you will work with one of our guides to help you go through those programs. It can be daunting. The health system is confusing, especially when you're the one that needs it. You don't want to deal with all that. So we have a team of people, almost call them concierge nurses, that will help you work through the system to get the best care for what you're dealing with at the time.
Yeah, because people have to deal with all these portals and all these appointment systems, and it can be, especially for some of the people that are retired a while, it can be daunting just to navigate all that.
It is, and a lot of people aren't tech savvy, right? And so we're pushing everybody to the web, and although we push people to the web too, sometimes you just need that little extra help, and Compass Rose is there to do that.
And before we let you go, just a little bit more on that Medicare Advantage plan that you are offering.
Yeah.
Does that fill the donut hole? Is that what's popularly called between, there's gaps in coverage sometimes, and
Yep,
that's
there's
what
no
that's
gap,
aimed at?
no gap in coverage. One of the important things is we've heard feedback that people feel that they will lose their FEHB status if they go into a Medicare Advantage plan. If you're within FEHB and you join an FEHB Medicare Advantage plan, you will not lose your FEHB status, and you can't lose your FEHB status because you would no longer be eligible for that Medicare Advantage program. So I want to make that perfectly clear. You would stay in your FEHB, so you would stay a Compass Rose Health Plan member, and we would add this option on for you. There's no donut hole. There's nothing like that to worry about. Prescriptions are covered, so that wouldn't apply.
Yeah, prescriptions are the scariest thing, I think, for a lot of people these days. And generics and all those are covered.
Yep, we have generics on our Compass Rose plan. Our generics are $5, and on our Medicare Advantage, they're $1.
Wow.
Yeah, so
less than a box of Band-Aids.
You can't even get a cup of coffee or even a cup of tea for that. So yeah, $1 for your generics on our Medicare Advantage and $5 on our active health plan.
And by the way, for those virtual visits, what is the copay there?
$0. So unlimited, $0. I don't know where you can get a deal like that.
Nobody's going to go to the doctor.
Well, but that's not a bad thing. Unless you need to, then you need to go.
All right. Well, thank you so much for giving us a lot to think about.
Yeah. I hope this was helpful for people. And if you have any questions, reach Compass Rose. And we thank you for letting us be here with you.
All right. My guest today has been Sherry Hebert. She's Vice President and Chief Operating Officer of Compass Rose Benefits Group. I'm Tom Temin. You're listening to Federal News Network. Let's go back to the studio now for more on the Open Season Exchange.